My name is Marion Delcroix. I'm working as a pneumologist in Belgium in the University Hospital of Leuven, and I'm in charge of the pulmonary disease clinic at this hospital. So I was doing some research on pulmonary embolism when I was contacted by a group of people doing a study, multi-center study on pulmonary hypertension and the relation with anorexigens. And so then I get in contact with the PH community, and we identified that anorexigens were a causal factor for pulmonary hypertension. And that was in the year 93, 94. And since then I've been working on that. I was working in Brussels in hospital, and I moved to Leuven just to be in charge of the pulmonary disease clinics. And so this was my first contact with the disease, and then we had the opportunity to treat the first patients with prostacyclin in '96, and then we start to make a difference for the patients. Before they were treated only by lung transplantation. But we had a lot of patients, but of course there was patients who are more confronted are the children. And so we get families with genetic anomalies where all the children were sick, and this was quite confronting. So we were very much involved. We were 24 hours in charge of these patients. And so even now, again, I have a young family, which is also, all the children are dead. This is the things which are, of course, the most confronting. We have a lot of older patients, even very old patients, but it's always with the kids that you are more confronted and that you try to do your best. Until now, the association, the World Meeting for Pulmonary Hypertension, has been related to summarize the knowledge and give it through to the community. Now it seems that we are going more in trying to design the field, to see what are the needs, what are the study we need, and so also to go for collaborative research. So it's quite a movement which is interesting, and we see what happens. The most important field in the future will probably be still the biology, because we have to find more efficacious therapy. We have to be able to reverse really the process of the disease. So it's in the lung, which is the most important part of the disease. Another way to work is also to try to help the right ventricle to cope for the increased pressure in the pulmonary circulation. So for me, these are the two therapeutic advances. I'm not sure that we will have a lot of advance from artificial intelligence in the disease, also not from device and monitoring of patients with devices that I'm not sure will help, but I'm still hoping that we will find the real causes of the disease.